We're going to go to the next step of the prep system for pregnancy health. So we've talked about positioning of the spine, positioning of mom, our posture, chiropractic ways to improve upon the positioning of the body to help relieve pain. Now we're going to start talking about sleep because rest, the R, P-R, R is for rest. It is so important that we get enough rest. That will help relieve our pain. In most chronic pain studies, people in chronic pain also have a sleep disturbance, leading us to realize that sleep or lack of sleep will lead to pain. We must get a handle on proper sleep patterns if we're going to make sure that we have a life feeling as good as we can possibly feel. There are 4 stages of sleep, but we're going to talk about what happens during stage 3 and 4, which is why it's so important that we get those stages. So stage 3 and 4 are the deepest and most restorative sleep. Our blood pressure drops, our breathing becomes slower, our muscles become relaxed, our blood supply to the muscles will increase, tissue growth and repair occurs, energy is restored. These are very important things that are happening in stages 3 and 4, and a lot of times we don't get there, or as we're cycling through the different stages of sleep, we don't get through those stages enough times to really get the tissue growth and repair, the relaxing of the muscles, the energy being restored. It's so important. Hormones are released, like growth hormones, essential for growth and development, including muscle development. You see, your body needs sleep to heal and repair tissues. If you don't get enough, your body cannot do what it needs to repair. So you'll continue to have more pain than you should if you don't get enough sleep. So for some of us, there's a major issue keeping us from sleeping. For most of us, we just need to turn off the TV. We need to think about lowering our stimulation levels in the evenings because that will make it difficult for us to fall asleep at a different hour. Or for some of us, we've just decided that we only need a certain amount of sleep. However, we can't understand why we're not experiencing the health that we would like to experience or that we feel that we should be experiencing. So make sure your activities wind down well before bedtime and get to bed early. Your body will thank you for it. It's pretty clear that your body will not heal if you don't sleep. So let's make sure you get more sleep starting today. Now let's talk about sleeping positions. When you are sleeping, try to keep a very neutral posture. Ideally, and when you get to a certain level of pregnancy, you're going to have to do this. You're going to need to sleep on your side, and ideally on your left side, because that allows for more nutrients to flow to the placenta, with a decent sized pillow between the knees to keep the pelvis stable. If you can, have one knee forward with a pillow underneath that knee. That is an ideal position for you to stay neutral, for your pelvis to stay balanced, and for you to stay asleep for a much longer period of time. So now we've talked about positioning, we've talked about rest. Now we're going